Welcome, ladies and gentlemen, to our second episode of Harness Racing Victorian Breeders, Vic Breeders Australia.
Harness Breeders Victoria.
Harness Breeders Victoria, breed to succeed. How am I going, Kath? I'm off to
real
a
good.
big start. I've had everything else up and going and got it all right, and then I forgot my most important intro. Today's show is actually about placentitis and what does it mean for your mare, and we'll definitely get involved into that very, very quickly. It's brought to you by Nutrien down the bottom, and at the end of today's show, there'll be a lucky winner will be drawn out of our members bag, and they will get a free slot in the yearling chart.
Nomination, yeah.
And you've sold yearlings before, Kath. What does that actually entail? Is it a costly expense? Or?
So your free yearling nominations valued at $660. That's for entering your yearling into the sales. So yeah, it's quite a saving if you happen to win that today.
I must say too, with these seminars that we're doing here and the Breed to Succeed, it's great that people have put their differences aside. We've got Nutrien this week. We have got APG next week as well. So
Yep.
it's terrific that there's sponsors. There's a whole range of different sponsors, but it is really, really good. We've got a few giveaways. This is designed to be an interactive show. We want people to get interactive and ask questions. We had a heap of people last week. We had a ripping show last week on broodmare nutrition with Andrew Soper and Rebecca Ham. And Barristock each week have kindly donated 10 bags of feed, and I've already announced the winner. Have a look at that. I've already I'll leave it up there, but 10 bags of feed to the best interactive person that gets involved with this. And last week, .G, who I believe her last name is Green, there with a double E, but you must be a member of Harness Breeders to get part of this. But Dot was voted our winner by Andrew Soper, so she gets the 10 bags of feed, which is just a terrific saving, isn't it?
Yeah, super. Support from Barristock, we really appreciate it.
Yeah, it is. It's really, really, really good. I've got to get everything else going up here as well. I think I've got half of it up. I've got some people following me, yep, and just got to kill the noise. I told you, you have to have everything else. We will get on to what we've got today, but must say, people get involved. Kath's got a couple of questions in the middle of her seminar as well, but also any questions you have on this topic, please feel free to fire them into us at any stage, and we'll try and elaborate on them as we can. That's the whole idea. You've got access to one of the best vets going around. I must say quickly, no, I won't. It'll just confuse us. I'll get myself into all sorts of trouble. Kath, it's fine. But we want people to be interactive. But Kath's also got a couple of questions, so get ready with the typing, I suppose, and answer the questions. That way, Kath's looking at me. I'm rambling because I've just got to try and make sure I get through everything. We've already got quite a few people watching, which is really, really good. We definitely appreciate that.
We do want to make the session interactive, so there will be a couple of opportunities during the session for people to answer some questions that I have and see what everyone's knowledge is about. But also, if we don't answer the questions through the course of the presentation, there'll definitely be an opportunity at the end to answer those questions then too. And
that's one of the things too, even with Andrew Soper's last week, there'll be a lot of people who probably still had a few questions to ask about Barristock and the likes. They're going to come back on. Please fire your questions through to us any way you can, and it will give us for more backup. Kath's going to be on a couple more times. We've got a couple more seminars to do here in Kyabram, sunny Kyabram. It's not that sunny, but I must say the rain stopped, Kath, just as we've come on air, which is...
it's been steadily raining all day, but anyway, it is winter, so...
It is indeed. Kath, I'll hand over to you because, I mean, firstly, this word is not a word even myself and Nick Hooper weren't that keen on trying to get out. Placentitis. .G, you're welcome. She's already said thank you. She's so excited, which is terrific. And that's what we want, people to be excited to breed horses as well, don't we?
Yeah, that's it. That's the whole idea of these seminars, is that we want to encourage people to breed, we want to help those who are breeding, and we also want to try and minimise, wastage and loss in the industry, so that, everyone's hard-earned efforts that go into making a foal actually does end up success down the track, and, they don't have too many economic or emotional losses along the way.
No, and as we say, minimise wastage, maximise their return. But at the end of the day, have fun racing Standardbreds. That's what we definitely want to do. So what I might do, Kath, is hand over to you. You've got your slides ready, and you'll talk your way through this. But we definitely want people to interact at the start of it. And as Kath alluded to, there's going to be a couple of times where we're going to have some questions. So over to you, Kath.
All right. So what is placentitis? What is it, and what does it mean for your mare and foal? So placentitis is one of those things, it's one of many things that can potentially go wrong when you're breeding, but I think it's a really simple way to minimise loss with your mares and foals if it's managed or identified and then managed and treated correctly. So first of all, I would just wanted to give you some background information about some anatomy and what the placenta does, and then I think that will give you a bit better understanding of then how placentitis can affect the mare and foal. So on the screen here we've got the uterus of the mare. So we've got here where the cursor is the uterine body. The uterus is a T shape, and you can see it going off to the right and to the left, and we call each of these heading to the right, we call it the right uterine horn. They're referred to as horns, and the left uterine horn. And then down the bottom here is we have the cervix, which is a thick muscular structure, and it's designed to create a really tight seal to prevent anything from the external part of the mare getting in to where the foal is. So usually a foal is predominantly in one horn or the other. The placenta covers the entire uterus and is firmly attached to the wall of the uterus all the way around, and it must be to allow the provision of enough nutrients and oxygen for the development of the foal. But generally the foal is mostly in one horn and mostly the rest of the placenta in the other. So with this in mind, we'll look at the role of the placenta. So it's a physical barrier to protect the foal from what's happening inside the mare's body, but also from out. So essentially it's a really sterile environment in there, which is why it's so important that when the foals are born that they have access to adequate immunity, like getting the adequate colostrum from the mare's milk and getting that within the first 24 hours of life, because the foals have been protected for so long within the placenta, within the uterus, and when they're born, their immune system isn't developed, and they rely on that colostrum to give them that early immunity. So that placenta is a source of nutrients, so nourishment for the foal. It's also a source of oxygen and waste exchange. And it mostly is made up of two membranes. So we'll talk about some complicated words here, but I'm sure if you've seen a mare foal, once I show you some photos, you'll recognise, oh yeah, that's actually what that is. So firstly, we're talking about the amnion. It's white and it's thin and surrounds the foal, and then we talk about the chorioallantois, which is the really thick red part, and it's the part that's firmly attached to the uterus, and it's firmly attached all the way around, like with little almost like finger-like attachments, and this is the part that can get that can become retained and cause some issues to the mare if it's not delivered after the foal.
I'll just say that on those words, there was no way I was going to say any of them. Mr. Nick Hooper, you have tuned in, and I purposely didn't do them, but Kath's 8-year-old daughter had no worries spitting them out in front of me just there before, so they are big words, that's for sure.
So in this photo here, you can see this white thin membrane. That's what I refer to as the amnion. So this is what we see being delivered at the first stage of the foaling process, and we'll usually break that membrane over the foal's feet or the nose as it comes through to make sure it doesn't... those birds are very noisy in the background, sorry.
They're not galahs like at Elizabeth's.
Yeah. So so that's the amnion there. And you can see it here now that once the foal is born, you often see this when the mare first gets up, is the big long white area, which is the amnion, and the rest of the placenta is still within the mare, and that's the chorioallantois, which is the thick, very red vascular part.
And this is perfectly normal, isn't it? For people
Yeah,
that
this
might be
is-
watching this and thinking,
yeah.
geez, that looks unsightly, that's actually normal.
Yeah, that's normal. So that mare has just literally just got up off the ground having delivered that foal, and she's turned around to have a good look at it. So, and here, this is the chorioallantois, now that it's passed from the mare. This is what we call, and this is how we examine the placenta to check, firstly, to make sure that everything looks normal, but also to make sure that parts of it haven't been left behind in the mare, because that can make them really sick later on. So this F shape is what we refer to the shape of the placenta when we lay it out to make sure that everything's there. So down the bottom here, you can see this reddened part. That's what we call the cervical star. Now the cervical star, if we just go back a couple, cervical star is a part of placenta that just sits adjacent to the cervix here. And we'll see while it's later on, while it's important, this is where the feet burst through for the foal to come out.
Oh, yep.
And the rest of the foal lies in the rest of the placenta here. You can see this is one horn here, where we talked about the horns earlier, and this is the other horn here. And you can see that this one here is quite a lot bigger than this horn down here. So this is what we call the gravid horn, which is the horn that the foal was predominantly in.
Yep.
And here's the smaller horn down the bottom, which is that didn't contain the foal, but it was important for the development of the foal for it to be still present. And the little bit in the middle here is the umbilicus, and that attached to the umbilicus or the belly button of the foal. So this is how we check that everything here is normal. Sometimes you can get, when they pass the placenta, you can get small bits of the tips of these horns left behind. And if you know that has happened, it's really important that you then get your mare seen to make sure that gets removed before the mare gets too sick.
And that comes back to something a little bit later on
Yeah.
with placentitis.
Yeah. So bearing all that in mind, so that's all the normal parts of it, and that's the anatomy. So when we look at placentitis, we say, well, what is it? So it is literally an inflammation of the placenta. So the placenta is inflamed. But placentitis is the leading cause of abortions, stillbirths, premature delivery of foals, and the death of foals soon after birth as well. So this is why I think if we can recognise it in a lot of horses, and we can do that, we can easily manage and treat them to make sure that a lot of these things don't happen. So I'm sure everyone has at some point in time had this scenario with their broodmare. So placentitis can be that mare that is 42 days positive, but when foaling season rolls around, she's dropped off to foal down only to find out that she's actually empty. She's that mare that can abort at 7 to 10 months for no apparent reason. That mare that has foals that die soon after birth. That mare that tends to bag up and foals early, so she'll have a weak or undersized premature foal. Or perhaps she's that mare that has a foal that always seems to get sick in the first 24 to 48 hours after foaling. And also, and we will talk more about this later on in the information sessions, but a mare that has dummy foals. So dummy foals are foals that don't have a suckle reflex. There are a lot of reasons for that, but placentitis is certainly one of those causes.
So placentitis is not the sole cause of all these, but it is one of the major reasons behind them. It's not accountable for every part of these necessarily every time, but it is a contributing factor.
There are other reasons why like mares can abort or lose their foal, and that might be there's something wrong with the foal, or perhaps there's a congenital defect or something like that. However, it is one of the leading causes for these scenarios presented here. So, for all those Facebook viewers out there, I'm wondering if anyone can recognise what's going on in this picture. And while you're busy typing away what the answer is to that, I'll just talk about a little bit what's happening.
And there is a few people on there that should know the answer to this, so I'm looking forward to at least one of them getting involved. She should know who she is, but we'll just see.
So we've got here we've got this shiny part here, which is what I was talking about before, the cervical star. So normally the foal would pop through that, and the foal would be born, and the placenta would be left behind to be passed afterwards. But in this situation, the placenta is coming out with the foal, which means that the placenta is actually detaching from the uterus prematurely, and this means that the oxygen supply is being cut off to the foal, and these type of situations are an absolute emergency to try and get the foal out and get them access to oxygen really quickly.
We've got two people that came in. It's a dead heat for both of you, Sue Markwell and Denise Jackson. Both of you spot on red bag delivery, so well done to you.
Yes.
Marie, my wife, misses out because she wasn't ready. I can't believe she didn't type in quick enough.
So that's what we call a red bag delivery, and a lot of you may have heard that terminology around before but didn't actually really know what it was associated with. So basically it's the placenta being delivered with the foal, which means it's let go from the uterus and no longer can pass on oxygen to the foal. So how does placentitis happen? So we can see the way it can manifest in those scenarios I talked about, but how does it actually happen? So the number one way that it happens is that it's infection that is passing up from the external genitalia and through that cervix. So the cervix is normally nice and tight and forming a really nice barrier. Bacteria and infection can get up through there towards the placenta. So sometimes it can be associated with previous trauma from foaling. So perhaps the vulva has been damaged, or the cervix, and that can alter that protective seals that are normally there. Or it can be an accumulation of age of the mare and the number of foals she's had, and the loss of normal conformation of the vulva. And this lets in air and manure up into the vagina, which can go up into the cervix and towards the placenta.
Is it something that does happen with older mares, all older mares, or is it just some that are either unlucky or there's a contributing factor?
Certainly not all older mares. There have some older mares that have excellent conformation. It generally is associated with age and the number of foals that they've had, just weakening in the muscles as they get older. And then, also damage. But some mares just happen to have a bad conformation right from the start. So even we all think that a maiden mare is young and healthy and shouldn't have any issues, but that's not necessarily the
It can be. It can have conformation issues straight away.
Yeah.
Even though it's never been involved, never.
Yeah, that's right. Yeah, and probably as a rule, we tend to see more conformational issues in thoroughbreds than we do in standardbreds. So standardbreds are generally pretty good, but still certainly can see them.
Is this one of the things that maybe with AI has helped a little bit with the risk of infection, or?
Certainly AI it's a clean procedure, so and you're only putting into the uterus what has to go in, whereas a natural mating is dirtier, and there is a lot more being put into the uterus, so the natural mating will have a higher risk of infection potentially.
Yeah, so it has helped a little bit anyway.
Yeah.
Just one thing quickly before you go too far, Kath. Louise Pangrazio, she wrote red bag. She also wrote foal behind. Is that a different terminology for red bag, or?
What's that, sorry?
She said foal behind is the other part that she said, so no?
Maybe she's just saying that the foal is coming behind the bag. I don't know.
I don't know either.
Yeah, I'm not sure.
So, no, but she was right anyway. She had the right answer, and I'm just not sure on the other part of it, but yeah.
So while I go through this sort of a chart talking about conformation, perhaps some of you Facebook viewers might be able to tell me what is the quite a basic surgical procedure that we would do to improve the conformation of the vulva, or at least prevent the contamination that can occur from having a poor conformation. So you can see here in the group of mares, at the top here we've got the tail. Directly underneath that you have the rectum, and then in a straight line beneath that you have the vulva, and this here is the bony part of the pelvis. So you can see here everything's nice and straight and in alignment. Now as the mare gets older, it perhaps has more foals, there becomes a slight angle to the vulva here, and as time goes by it slowly starts to angle in. in this mare, she has about 50% of her vulva above the bony rim and about 50% below. If you go down to group 2, there's probably 2/3 of the vulva above the bony rim,
Yep.
and 1/3 below. So as you can see over time, in a mare with this type of conformation, you get an even flatter vulva
Yep.
over time. So this means that when the mare passes manure, it drops down straight onto the top of her vulva before dropping on the ground. Whereas when they're in a nice upright conformation, it just all lands clear. So in a mare with a conformation like this, there's a much greater potential for contamination due to the conformation. And in the third group, you can see that almost all the vulva is above that pelvic rim. So as time goes by, the conformation is almost horizontal. So this is probably the worst scenario you can have for potential contamination and infection.
I'm very happy to announce that my wife got it right first. She must have took the first one wrong. She's called it a colic suture. Is that suture?
Colic suture.
Suture.
Yeah.
Okay. So the words Louise Pangrazio, Jared Maloney, Susan Daniels, Stacey Towers. All got it right. Sue Markwell, you're right. Everyone knew that one. And Steve Johnson wrote that they typed too quick for me, so it was good. Noel Ridge has also joined in, so we've got a good group of people. We appreciate it. And please, if you've got any other questions for Kath, don't have to wait for the prompts to fire them through. Please ask them, and we'll bring them up at the right time anyway. So sorry, we'll let you keep going with the colic.
Yeah, right. So that's exactly right. It's just called a colic, and sometimes, excuse me, sometimes a colic procedure is also performed on racehorses. If they're sucking wind behind, this is a common procedure to do, and it's just a matter of suturing the two sides of the vulva closed, and then allowing enough room still for the mare to pee out of. So you can see in the actual picture on the mare here, this is a vulva that has been sutured closed and is healed, and this mare has got quite a horizontal vulva because here's a rectum up here and it's looking quite flat, and then there's a small hole there for her to still pee out of. So you can imagine the potential contamination that you would be causing there if the manure was landing onto that open surface. So that's why you can get such an infection tracking up to the cervix to lead to placentitis. So that's why it's our number one cause. And sometimes mares like this too, just to get them in foal, you have to control this level of contamination, not just to prevent it during pregnancy. Yeah,
it would be a problem all the time, even when they're not in foal. Even if you give them a year off, it's still something you'd have to get them colicked up to look after them and keep it clean.
Yeah, and that's an important point, because sometimes just because you foal and you decide not to serve them that year, sometimes it's nice to make sure that the uterus is healthy, and maybe if she needs to be recaslic, you recaslic, because in a year's time when you go to rebreed her, if you haven't, then you've got a year's worth of infection and build up that's been sitting there that you then have to tidy up before you breed. So it's easier to fix before it's too bad, and then you can breed as normal the following year if needed.
We've got one question. I might leave that one just for a little while, Dot. We'll get to that at the end of it if you like.
So how else does it happen? So we've talked about the infection going up. It can also happen from the mare having an infection. So perhaps she may have had some really bad colic or diarrhoea, or perhaps she has had some chronic tooth issues. So tooth, which highlights the importance of keeping up to date with your mare's teeth and dental work, because not only from a nutritional aspect, but if you get build-up of grass and feed in there, you can actually create a nasty sort of infection, and that bacteria will circulate through the bloodstream, and it can cross into across the placenta to the foal, and that can, if it's a severe infection, the foal will then it can infect the foal, and the foal can die and it will be aborted. Or if it's a lower grade infection, the foal can still get infected and be born either weak or unwell, which can rapidly escalate after birth in that first 24 to 48 hours. So that's another way. Another thing is if the mare's already had a pre-existing infection in the uterus, so this could be bacterial or fungal. we used to just, swab the uterus or perhaps flush the uterus and spin down the fluid we get back and culture that in the laboratory. But nowadays we actually scope the uterus just like you would scope the airway of a racehorse. So we'll pass the scope up in there and basically inflate the uterus with air, and we can drive around and have a good look inside that uterus. And it's quite amazing what we're seeing with the scope now. Like, it's pretty cool. Like, there's often little pockets of pus that we've cultured and grown nothing. But until we actually directly sample that piece of or area or little nidus of pus, then we finally identify the bacteria that we need to be targeting, and we can treat it appropriately. So we're learning things all the time, but that's definitely a really good investigative tool for us now, because if we can get on top of a lot of these bacterial or fungal infections early, then you have less chance of them being an issue during pregnancy.
So one of the questions off Facebook is that from .g, it's hi Kath, is there any indicators during pregnancy that the mare may have placentitis, like change in behaviour or eating, which I think you've just covered off on, rather than during delivery or early delivery she may have obvious difficulties occur? And then my wife's written back that you can actually have your placenta scanned and observed, so that's some of the things you can do.
Yep, so I can elaborate on that further.
Actually, just before you go too much further, because Dot's come back in with another one, she goes, thanks for this info. She's lost 2 foals close to birth. Hearing what Kath has said makes me think this is what she may have had. So it's ringing home to some of the people anyway. So you can't win the bags 2 weeks in a row, Dot, but you're giving it a good crack, I must say. So
I'll answer some of those questions that Dot had in the next couple of slides.
Yep.
So what does the infection inflammation do? We've talked about the ways that they can get it. So basically, when the placenta gets inflamed, it gets thickened, and when it starts to get thickened, it pulls away from the attachments with the uterus, and therefore the foal gets less nutrients, less oxygen. And as I said in that very first slide with the anatomy of the uterus, the foal needs the entire uterus to be able to develop. It needs that entire attachment, which is one of the reasons why mares are not very good at having twins, because they can't possibly provide that much nutrition to 2 foals at once. They need that entire area to support the one foal. So when it starts to get thickened and pull away, then the foal's not getting everything that it needs. So that's what, you can have a foal that's underweight at birth, or perhaps weak or underdeveloped when it's born. The inflammation and infection can also lead to production of a hormone called prostaglandin. It might be familiar with the term PG, which is just our short way of saying prostaglandin. Prostaglandin, or PG, results in the contraction of the uterus and therefore causes an abortion. So that's, particularly in the later stages, you'll get an abortion. And then earlier, so sort of up to 100 days of gestation, if you've got inflammation, infection there that is starting to give you prostaglandin release, that will then counteract the hormone progesterone. So I know this sounds quite complicated, but progesterone is designed to maintain the pregnancy. But if you start to get high levels of prostaglandin, it overrides the job that progesterone does, and you'll get pregnancies lost, sort of between 42 and 100 days. So, I mean, there are other reasons for that too, but that's one of them that can happen. So sometimes with these high-risk mares, we'll also maintain them on progesterone just to keep ahead of that prostaglandin level. And then the other thing is the foals can physically develop an infection themselves, and then that will lead to, they can lead to abortion from there, or it's born, septic or ill or weak, which are those foals that, die soon after they're born, or perhaps they're born seemingly okay, but rapidly decline 24 to 48 hours after birth, and they've usually already got the infection on board when that happens. So that's what happens when you get infection inflammation. Then, to answer Dot's question, how do we diagnose this? So The mare's history is number one. So I have quite a number of clients that when they're looking at buying brood mares, they'll say, hey Kath, can you have a look at this mare for me? Have a look at her breeding history, make sure there's nothing in there that I need to consider. So I'll get on the HRA website and look down their breeding history, and if they've got missed, foal died, slipped, maybe they've had a couple of foals, missed again or slipped, then they all start to ring alarm bells that, hey, maybe this mare's having some issues here. Yep. Now, that doesn't mean to say that mare is no good, and this is what I want to highlight from this session, that these mares, don't get rid of them, keep them, seek the appropriate advice, and you can manage and treat them quite effectively. But it's just nice if you're aware of some of those things before you go and buy the mare, so that you can think things through, talk with your vet, and work out a plan of attack on how best to get that mare pregnant and get that foal through a pregnancy and to be born vibrant and strong at the other end. Because ultimately, we're breeding to succeed, and we want to have healthy, happy foals being born year after year. With
minimal complications, then it makes it cheaper as well for people going on. And it'll be one of the questions I will ask you probably towards the end of it is the cost of a lot of these things too. Yep. But we'll get to that at the end. So
breeding history. So if you've got a mare and she slipped a couple of years ago, but perhaps she's just been down the paddock and you haven't decided to breed her, and you take her to whoever is going to be doing your breeding, mention that she lost a foal or a foal died soon after birth a couple of years ago. All those details are really important. I always say to my clients that, if you, I want all the details. If you're not sure, just ask. I'd rather you ring and ask me something than in 2 days' time ring me and I say, oh, I wish you had have talked to me, right at the start. So, any information on their breeding history is essential. Any history of the foals, with illness after birth is also really important. So it's all that, gather as much history as you can. Other ways that we can diagnose these sorts of things, if you've got a suspicion that the mare has a bit of an issue, is to do ultrasound. So basically, I talked about how when the placenta gets inflamed and infected, it gets thickened, and it's that thickness that we're measuring on ultrasound. So you can see on this ultrasound here, we've got the fetus or the foal on this right hand side, and then we've got the amnion, which you all know what that is now. It's that white sac.
Yep.
And then here the allantois, we want to be measuring the thickness of it. The cervix is up here, and we're actually measuring that thickness. And in high risk mares, we will actually measure that once a month. So keep an eye on them. It's a relatively simple and effective procedure to do.
Is every horse different? Is it I know it might sound silly, but is there a set distance that you measure and you say, well, that's a worry, or is it each horse has their own thickness initially, and then if it gets thicker over a period of time? Does that make sense?
Yeah, so there's guidelines around where and what part of the placenta that you measure and where you measure it. So, and then you can keep a record over time. So,
yep.
So it's more around the technique of the ultrasound.
And the individual horse as well, as they're all vary. Yep. Good.
So other ways you can look for clues of it or the potential for it to be a problem in the future is at breeding time. So actually having a look at the cervix or manually palpating it for signs of damage from foaling. Like we talked about placing a caslic at breeding time, just make a note that if you do caslic the mares, then you need to make sure you remove that prior to foaling the next year. We usually do it sort of roughly 3 weeks before a mare's due to foal. And the other sign that
before you go too far, is there a safe period that they won't get the infection because the foal's too big, or at any time they can start building an infection up?
Yeah, at any time really,
Yep.
Because if something can get through the cervix and into where the placenta is, then it can affect the foal at any stage.
Well, okay.
Also premature bagging up of the mare. So if you know that your mare's due to foal at the start of November, but you notice that she's already starting to bag up at the start of October, we think, well, hold on, that should ring some alarm bells, and actually get her out and inspected. And a veterinary assessment will allow you to, potentially put her on, depending on what they find, but put her on antibiotics, anti-inflammatories, put her on progesterone, which is a hormone supplementation we talked about before, and try and manage that mare through to when the foal is ready to be born. The foal isn't mature and able to be born until sort of 5 to 7 days before they're due. Like the foals come when they're ready. They're not like cattle. You can induce calves in cattle so that they don't get too big. It doesn't work like that in mares and foals. The foals come when they're ready. So the more you can carry them through towards their due date, and the longer they go, the more viable your foal's going to be.
So the better for them. So,
Yeah.
and back onto last week, listening to Andrew and Rebecca, one thing that blew me away was that the last trimester of a foal, they do 80% of their development in that last time. So to be able to maximise as long as they're in there,
Yep.
you're going to get a lot more benefit. The two go hand in hand, basically, don't they?
Yeah, that's correct. Yep. So, how to treat and manage. So some of these things we've already looked at. So colic surgeries, doing cultures and treating appropriately at breeding time. Something we commonly do as a safeguard, it's a pretty economic and effective course, is to do 5 days of antibiotics at the start of each month for the entire gestation of the mare. We have a lot of mares that go on that, and we don't have any issues long term with that, and it seems to it's a really nice insurance policy.
Yep.
Ultrasound high risk mares, or mares that have issues, assessing the placenta thickness. Talk to your vet if they're bagging up too early. If you have a foal that's born weak at birth, get some veterinary attention to it as soon as possible. Because the earlier you intervene, the more likely you're going to have a better outcome, because foals can be they can be really fickle, because one moment you've got them, the next moment you don't. So the earlier you can intervene and start some assessment, the better. And the other side of it is actually weighing the placentas.
So
we talked about how placentas get thickened when they're inflamed. So the thicker they get and the bigger the placentas get, the heavier they are. So if you go to weigh them, you need to know what's normal. So the foal birth weight is approximately 10% of the mare's body weight. So for example, if you've got a 500 kilo mare, you will have an approximate 50 kilogram foal at birth. The weight of the placenta is about 10 to 11% of the foal weight. So if you have a 50 kilogram foal at birth, your placenta is probably 5 to 5.5 kilograms in weight.
That's simple.
Yeah, and it's a really effective way of, even if you try and lay it out in an F shape, but you're just not sure what's normal, what's not, you put that on a set of scales, and suddenly your placenta weighs 7 kilos and your foal's about a 50 kilo foal. Well, it's sort of a pretty good heads up that something's not quite as it should be, and perhaps you should investigate a bit more with that foal, because it may be a sign that something is unwell.
In the foal.
Yeah.
It's not a telltale sign either, though. It doesn't mean necessarily you have to panic, but you should just ring the vets and just say, and if you tick every other box, you might say, well, it's all good. It's just an anomaly. But yeah, that's a great little tool, isn't it? 10% and 11%.
And look, some standardbred foals are born even bigger, like they're massive. So, you might have a 7 kilo placenta for a 70 kilo foal. Like, some of them are monsters that are born. So you just got to, I guess, keep it in perspective.
Are you better off working it out off the foal as compared to the mare? Like, so if you just said then, so if you have a 500 kilo mare but you've got a 70 kilo foal, are you better off if the placenta is 7 kilos? That's well within the range, instead of saying it should have only been 5.
Yeah, that's just a bit of a guideline, but yeah, it should be, the percentage should be more of the foal's weight.
Very good.
So I guess the take-home message is we want to try and minimise as much loss and wastage in the industry as we can. The foal population has been on the decline for some time, so of those foals that are being bred, we do want them to be as healthy as possible and get them on the ground safely. Don't discard your mare if your mare has aborted a foal, or if she's had some issues around foaling. Seek some advice around that, and perhaps we can prevent that in the future. If you're purchasing a mare, just run the mare past your vet or whoever you trust, and just say if there's anything there you need to note in terms of breeding in the future. As we know, breeding is a game for stayers and not sprinters, so it's never easy, and you can have complications with maiden mares as much as the older ones. We want to try and minimise any emotional and economical loss, which always comes with when you lose a foal, whether it's the disappointment that you're expecting a foal to arrive only to discover the mare's empty, or perhaps you get her 9 months through the pregnancy and you find the foal out in the paddock. It's not nice and it's not easy. So it's what we're here for, is to try and help you through those situations and prevent them. And also, don't discount the importance of foaling down a mare properly. When a mare foals, all the information of their foaling is really useful. So was there an issue with positioning that could have potentially damaged the cervix, or is there some damage to the vulva that needs repairing sooner rather than later to ensure that you get a nice external seal again? Is the foal a bit weak when it's born and it just sort of a bit slow to get up and about? Should we just sort of get it checked out, get the colostrum into it, because that sterile environment that should be the uterus and the placenta, those foals need to get their immunity up and going once they get out into that dirty world outside. So just don't discount that, the importance of foaling your mare down properly and all the information that then provides you with.
Absolutely. It's interesting too just how these flow over. Next week's episode is actually with Nick Hooper, and it's about the tools that harness racing have available. And Nick is watching, he's tuned in, as well as a lot of people have. We'll actually cover off. So anyone's wondering how you get onto the website and do see a mare's history, we'll make sure we show that in next week's episode, which will be a Zoom meeting for a lot of the participants out there. We won't be visiting Nick in person, but we will showcase how you can access the mares and find the mares' foaling history out in that segment next week with Nick Hooper.
Because ultimately, and it's a bit of shameless self-indulgence here, but we all want to be producing a champion like Poster Boy, or a champion like Soho Tribeca, and ultimately breeding champions from these two sides as well. So just thought I'd just pop that one in there. Sorry.
You got that one in there.
If anyone has any questions today or down the track, I'm always happy to have a chat and answer them.
We've already got some questions, Kath. Kath's got a working vet clinic here as well. If people think, I wonder what she got sidetracked for, she's just got a little bit going on, but that's okay, we'll get there. Steve Johnson, I think the first one I'm going to forget is, should you always weigh, and then he's put 2 A's, but I think the second one's not quite the same. Should you weigh every mare's placenta?
Yeah.
Yes.
Yeah.
Okay.
Yeah.
Very good. So
it's easy to do, and it just you can record it from year to year with those mares, and you can establish trends, or it just might provide you with that little bit of extra information if it's a bit heavier than what you'd expected.
Steve Johnson said, nice plug. I'll give the farmer a nice little plug there out in the background. We've got the weanlings. They're a little way away because it is, and it has stopped raining since we've done the show. So we can do plugs. Don't you worry about that, Steve. We know how to do them. We've had heaps of people watching. Jess Tubbs has joined in. Rebecca Cartwright, Norm Dunbar, Tracy Commodore. I got it out this time, Trace. I have a lot of trouble with Trace names. Beck Morrissey, Brooke Donaldson, Matty Gaff, Brendan Cohen, lots of different people going through. I've just had another question. I will get to it, but we'll get back to .G's question. She's trying to win more of the barra stock, but at the same time, I'm enjoying being educated and helping my mares and foals as a new breeder. Well, we appreciate that sort of feedback too, Dot, because that's exactly what we're after. We want to get more people involved in it. And is the kilo of the mare, 500 kilo for example, her empty weight or her weight before foaling? And that's from Desiree, I would imagine, because it's off the Harness Breeders Victoria site.
Weighted foaling.
So with the foal inside. Yep. So when she's still got the foal inside, that's what she should be weighing. So yeah. So that's all good. But yeah, we've had a fair bit of feedback so far with this. We've had a lot of people watching it, as I said, and we really appreciate it. But if anyone has got any questions out there, we will still be going. We definitely have a couple of things we've got to get through. One is. Last week, Anne Anderson, do you recommend an IgG test on the foal?
Yes, I think it's there's two parts to that. Sometimes we don't know if the colostrum quality of the mare is good enough, that even though the foal might be on the suck and appearing to consume enough colostrum, that maybe it's not of a good enough quality. Or sometimes, so that when the foal is suckling the colostrum, it's actually only absorbed for the first 24 hours by the gastrointestinal tract of the foal. So the first 12 hours is really good absorption, and from 12 to 24 hours that absorption drops off. So if the foal's hasn't consumed enough immunoglobulin, which is the IgG, then that foal won't have adequate immunity to then fight off any infections down the track. So because they're born essentially naive, getting that colostrum into them is really important. But sometimes you think you've got it into them and everything seems to be going okay, but for whatever reason it's not absorbed, or the mare's colostrum's not been as good as what it could have been, and they'll have an immune level it's too low. And that means that down the track, if they get an infection, they've got absolutely no backup there to fight it with.
And that causes other issues and again more expense, which is again another thing that we're definitely trying to stop.
And an IgG test is quite cheap and effective, around $85. And we there's a number of different sort of kits you can use, but we use ones we can use on out on farm, out the back of our car and things like that. Just a matter of collecting a small blood sample and away you go. And
that gives you a lot more peace of mind. Again, like we're trying to do is get people to sleep.
It's a really good insurance policy. Yeah.
Absolutely. Today's episode is being brought to you by Nutrien Equine. As we said, we're about to draw out someone's name, one of the lucky members who are paid up members, but we want people to be members. We've had a steady little influx from these 3 shows. We want more people to be members of Harness Breeders Victoria. It's essential that you become part of it, become part of a voice, so we can do more of these and also more of a lot of other stuff too. Like there's a lot of other things going forward. Last week's lucky member won a free service fee to Speeding Spur, donated by Woodlands. Got the Woodlands beanie on. Andrew Soper was watching. There's no chance of me wearing your caps, mate. It's freezing. It's a bit like you last week. I'm trying to stay warm. So got the beanie happening. But just before we draw someone out, Marie said such as joint illness. So IgG test will stop joint illnesses as well and detect them.
So it won't stop a foal from getting joint ill. However, if you detect that a foal has a low IgG, then you can administer plasma so that you can give it an artificial form of immunity. And so that if it does have bacteria circulating around its bloodstream, it's able to fight that. Now, a foal that doesn't have adequate immunity, so a low IgG, if it has bacteria circulating around its bloodstream, then it has nothing to fight it with. So, and what happens is then one of the common outcomes of that is joint ill, because when the blood's circulating around in the blood in the joints, because the foals are rapidly growing, there's lots of narrow blood vessels there, and the bacteria will get into those sites, which is why joint ill is quite common in foals. And then you've got a real problem, because you've got not only a foal that has no immune system, you've got a great big infection into an area that's meant to be sterile, and suddenly you've got to do a big backtrack. So an IgG test won't stop them getting it, but it means you identify when they don't have a good immune system so that you can give them one with the plasma to then stop that happening in the future.
We've got a lot of people waiting for this draw, but they're going to have to wait because we've got questions coming in and we want to get them out while we're live. Jared Maloney, would a mare with placentitis be more likely to produce less or lesser quality colostrum, I reckon that's where he wanted to put it in, compared to a normal mare, with a question mark? And he's not sure about the normal part either. He's sort of loosely saying that.
Yeah, so mares can certainly produce varying qualities of colostrum. If the placentitis is quite severe, then it can affect their ability to make good quality colostrum. Or this other side of it is that you'll get them starting to prematurely bag up, and when they do that, they'll often run milk for a week prior to foaling down, and they lose all that quality colostrum that they have, set up a bit of a bank of. And so then when the foal does go to suckle, it's just getting milk and not colostrum, so it's already been lost, on the mare's legs or on the ground, sort of thing.
And then the foal's behind.
Yeah.
Harness Breeders Victoria have sent this one in. If one mare in a herd experiences placentitis, are the other mares likely to have the same issue? Is it an environmental thing, or is it? There
are certainly there are viruses that can rip through a herd of broodmares. So equine herpes virus is one of those.
Yep.
So and there are vaccines for that. So it can cause what we call an abortion storm. If you get a herpes virus into a herd, when the mare aborts, all the fetal fluids and the placenta and the fluids are very contagious, and that can then go through the whole herd, and you'll get a whole mob of them abort. Unfortunately, it's not overly common, but as with anything, if you don't vaccinate for it, then it can rear its head from time to time. The other type is that there is it's the eastern hairy caterpillar. I know that sounds quite odd. However, it's been documented that if there are populations of these eastern hairy caterpillars in trees or on parts of a farm, that they can cause abortions in mares. And it was originally found up in the Hunter Valley, and they were actually finding parts of the hairs in the placenta and in the aborted parts of the aborted fetus when they were analysed in the laboratory.
Wow.
So that one's a bit of left field, but that could certainly affect a group of mares like that. But for the individual mare, which is most of the time, that individual infection won't necessarily infect the other mares. Yeah. Unless it's the virus.
I could be wrong here, but is equine herpes more prevalent in thoroughbreds than standardbreds?
It doesn't. Standardbreds are just as likely to be able to get herpes as thoroughbreds, but perhaps the way we manage our standardbreds is the management of the standards versus the thoroughbreds that sees it a little bit less common, but it can definitely happen. I
go to a lot of farms and I just know there's a lot of herpes in the thoroughbred. Shouldn't say a lot because people come to me and say, where are they? But you do hear of it in the thoroughbreds. Don't hear of it as much in the standardbred fraternity. But and .g, thanks Kath, very helpful for your information for a new breeder. Lots of information for me today, great job. I reckon you're going to have to go back and watch it a couple of times, Dot, because there was a lot of information, and that's the idea.
I hope that wasn't too much info, but if people have questions, please come back to me. I'm happy to elaborate or expand upon any of those areas. There are so many things to cover, but hopefully in this educational series we can cover off a few more of these issues for people.
One more, Louise Pangrazio. We're going to get to this members draw. Can foals be affected by salmonella? It's a relatively big issue with dairy cattle. Wondering about the foals.
Yeah, and there is a equine vaccine for salmonella, yes, the answer is they can be affected by salmonella.
And simply just to vaccinate them can help them.
Yeah, it can vaccinate, yeah. So it's all about, once again, the immunity. So you're vaccinating the mare before she foals. So whether it's like doing tetanus and strangle vaccinations, equine herpes vaccinations, and salmonella, you can do them. You give them to the mare before she foals. Those immune products go into the colostrum, and that's how it covers the foal when the foal's born, through the colostrum, the immunity that the foal gets through the colostrum.
Yep, very, very good. All right, now we're going to draw this member. You're going to draw it. I'm not putting my hand in there. It's your job.
Your Aldi bag.
I didn't have to go up that high for Dennis, Bice and Mark, if you're wondering. I just didn't have to go that high at all to get this one.
So the winner is Adam Wilkinson.
Yep, Adam's from, I think he manages Betfair Park in Werribee, so he'll be very, very happy. He does breed horses too, so he'll be happy. I'm not sure if he's a seller, but he'll definitely work that part out going forward. Kath, I've learnt a lot. I'm probably a little bit brain numb towards a few of the things. I think it's been terrific. If people want to be able to watch this again, by all means, just sit back on the Facebook page and re-watch it, but you can get it on Campbell's Comments. Harness Breeders Victoria will be putting it up on their website as well, probably tomorrow or the next day. It generally goes up, and watch it as many times as you want. Don't be scared to come and see you at a few of the trot meetings. You were definitely at Bendigo last night, obviously once crowds can get back with COVID-19, but and also get in touch with you here at Northern Rivers Victoria. It's not a cheap plug, but you do a lot of the work behind the scenes, so you might as well get a plug in, that's for sure. So there is plenty going on as well. Fred Cruz says, congratulations, Adam. So I'm tipping I'm on the right person. So, yep, Noel Ridge, very happy as well with it. As I said, we'll be back next Sunday. It won't be a live. We'll be, I'll get that one off you, Kath. I've got a close-up on you. It's not, is that better? We'll be with Nick Hooper. We'll be working out how to use all the data, all the tools that are there, provided. Majority of them are free of charge too, so it'll be very beneficial. It will be a Zoom meeting, but it'll be terrific going forward. And then we'll be back here. Oh no, actually I'll be back with Andrew and Rebecca with the mares and yearlings from Barrastock and Kentucky Equine Research. So we'll be back with them on the 26th of July. So we've got quite a few still to come, and we've got quite a few people coming back. So Brett Coffey said that Adam's got a couple of Nutrien entries already, so Adam's happy, but Nutrien aren't because they've one less. But that's great; they'll get value for their money. And Louise Pangrazio said thank you. Sue Markle said thank you. So yep, appreciate all the feedback. We appreciate everything, and yeah, we've got to catch up with Brett Coffey going forward too. I can't wait for that one. That'll be an hour-long one. That will be, because we're talking about pedigrees and how to find them and matching them and the like. So hopefully people have enjoyed it, and yeah, stay tuned till 4 o'clock next Sunday, same station, and yeah, we'll go from then. So thank you very much, Kath.
Thanks.